Here we have MRI on 60-year-old with history of acute left-sided neck swelling. We have got axial T1, fat sat T2, and coronal stir sequences here to show. What we have got here is in the left parotid region, the abnormality is situated. How to describe this abnormality and infer? There is diffuse enlargement of the left parotid gland. It shows diffuse ill-defined heterogeneous signal intensity, which shows low signal intensity on T1 and increased signal intensity on fluid-sensitive sequences. The margins are smooth and well-defined throughout the parotid gland. There is mild thickening and abnormal signal in the adjacent superficial subcutaneous tissue. There is no evidence of any enlarged lymph node, no focal lesion, no evidence of underlying collection. The right parotid gland appears normal. Both submandibular glands appear unremarkable, nil else. So, how to infer it? So, based on these findings, the features are most likely to represent acute sialadenitis with no evidence of underlying collection. So, what can we do about this? So, this needs correlation with clinical symptoms and signs and inflammatory markers. If the symptoms and signs are not settling, or if the clinical features are not typical for uh, sialadenitis, then a follow-up ultrasound or MRI can be undertaken in 4 to 6 weeks and then proceed from there.